We are here. We had a few technical issues, but we are here nonetheless. Thank you all so much for joining us for another episode of Wellness Wednesday with Dr. Latoya Wells. I'm trying to get all of the platforms up and going, and I'm having an issue. So give me 1 second. I hope you all have had an amazing week thus far. We are at Hump Day. Um, I always wonder why they call it Hump Day, but anyhow, I I digress, and we'll figure it out another time. But just wanted to say thank you all so much for being here for another episode of Wellness Wednesday with Dr. Latoya Wells. It is a pleasure to show up here with you all each and every Wednesday for knowledge and education and all things health. So, as you all know, the month of June is Men's Health Month, and it's also Men's Mental Health Month, where we focus on all the aspects related to men and men's health. And so, tonight, as I mentioned last week, we will be talking about men's hormones and all the things that that are included in that. How about that? It's been a long day, y'all, but I'm here. So I wanted to just take a few minutes. I am Dr. Latoya Wells with Wells Legacy Health and Wellness. I am a doctorally prepared family nurse practitioner and owner of Wells Legacy Health and Wellness. We are a health and wellness practice, family primary care practice that caters to all. Okay. We're located in Altamont Springs, Florida, 452 Osceola Street, Suite 106 and 107. Our number is 321-306-6755. And you can find us on the web at www.wellslegacyhealth.com. Catch us on social media, Facebook, Instagram, YouTube, TikTok for more information on all things health. So there we go. We are in the month of June, and this month we're talking about men's health. Last week we just kind of did a general overview of men's health. You guys saw me in my office. I was seeing patients that afternoon, that evening, and so you guys got an opportunity to see me at the office. But most of the time you'll see me here in my home office. And so tonight we're going to delve into men's health and just understanding the hormonal component of men and how that changes as men age. You probably heard of menopause for women, and that's when there's a decrease in the hormones for women. And there's different issues or complications or changes, shall I say, that women experience as it relate to those decrease in hormones. Well, did you also know that men have something similar to menopause? It's called andropause. And we're going to talk about that a little later in tonight's session. What are the hormones? The male hormones. So whenever we're created, we have different DNA and genes that say you're either a male or a female. And with that, women have their specific hormones and men have their specific hormones. Okay. So when we're talking about male hormones, male specific hormones, we're talking about testosterone, which is the primary male sex hormone. This one regulates their libido, their bone mass, fat distribution, muscle mass, and strength. And some of the hormones are interchangeable because we can test men for certain hormones, but the male hormones are going to be dominant in men. Women do have testosterone levels, but their estrogen and things like that tend to be elevated more so than it is in men. And men also have estrogen, but their main primary hormone that indicates them as a male is the testosterone. And so again, it regulates libido, the bone mass, fat distribution, muscle mass, and also strength. And then it influences the production of red blood cells and sperm. We have something else called DHT. This is a potent derivative of testosterone. So you have the testosterone, And then a byproduct of that is DHT. And this one plays a role in male development, particularly during puberty. As we see babies being born, they begin to grow up, they go through that phase of puberty. We begin to see the DHT levels elevate as well as the testosterone levels. And the other one is androstenedione. I believe I said that correctly. It's a precursor of both testosterone and estrogen, and it affects sexual function and energy levels. So, of course, men also have estrogen levels and things of that nature. However, their levels tend to be lower because their most dominant hormone is testosterone. So, as men age, and as we begin to look at different issues with men, as men begin to age, or even some earlier, younger men, when we notice decrease in hormones, there's different things that occur. You begin to see a decrease in libido and erectile dysfunction. You begin to see some baldness, where the male pattern baldness begins to be impacted. But when we look at the levels and we draw blood work on these individuals and we look at their testosterone levels, when we notice that the testosterone levels are low, these are some of the things that men may experience: decreased libido and erectile dysfunction, reduced muscle mass and strength, increased body fat, fatigue, decreased energy levels, depression and mood changes, difficulty concentrating, and memory problems. And if we were to put a side-by-side comparison of women and men with estrogen and testosterone, we see similar side effects or similar changes within the body. The next one that we look at is DHT. We talked about that one and what that's responsible for. But when we begin to see a low DHT level, that's when we see the male pattern baldness. You see there's a reduction in the hair growth, and then potentially less pronounced puberty features. So whereas they have the stronger, muscle build, things of that nature, those things begin to change because of the decrease in the DHT levels. So some other general symptoms because of the low hormone levels is one, osteoporosis and decreased bone density, which is why it's so important, not just women, but also men continue with strength-based training. And what we see a lot is men tend to focus more on strength and less cardio. Well, there needs to be a good balance with that. Another thing is decrease. We begin to see a lower sperm count, and then infertility can arise. With the low DHT and low testosterone levels, doesn't necessarily mean that it has to be as they age. We do see some younger males with these levels being low, and it's causing issues. And so there are so many different things that we can do to help these men and these young men who are going through these changes. So when we talk about menopause and andropause, it's pretty much hand in hand. It's just specific to women and specific to men. So it's important as a male and as a healthcare provider that takes care of male that we are aware of these hormones. So men, I want you to take note of this. If you're watching this live, jot it down. If you can't remember it, if you don't have anything to write it down with right now, come back to this later and take note of this. So when you go to your healthcare provider, you can have a conversation about these levels and these different labs and different hormones that you can ask for blood work to see where you are, especially if you're noticing changes within your body. It's important to know what the levels are, how they function within your body, and what we can do in the event that there is some fluctuations or changes. Have you ever heard of midlife crisis? So when we're talking about men, primarily when we talk about men in midlife crisis, it's usually around the age of 40 when these hormone levels begin to decrease. So as men age, the hormone levels naturally decline, leading to various health concerns and health issues, as we talked about previously. There is such a thing as andropause, and it's often categorized or linked to male menopause, or we call it male menopause, and it is because there is a gradual decline in the testosterone levels. And again, it occurs around the age 40. So when, and midlife crises can happen to anyone, because when we look at women and when their hormone levels begin to decrease, it's around about the same time. And so we begin to see the difficulty concentrating, like all the things that happen. And sometimes I have patients come to me like, I feel like I'm going crazy. I feel like there's something wrong with me. And physically, we can look at some of the different things and the characteristics that are changing and say, oh, well, we think it's this. But the true way to find out is to get this blood work done, get the labs done, take a look at it and see where we are, and then go from there. So what are some of the health risks for men when these hormone levels begin to decrease? One is an increased risk of cardiovascular disease, so high blood pressure, high cholesterol, heart attacks, strokes, things of that nature. Those are things that we see become an increased risk for men as they go through andropause, or as we begin to see the testosterone levels decrease. The other one is a higher chance of developing type 2 diabetes. And if you can remember that I just mentioned what some of the signs and symptoms is increased belly fat. And when we look at the increase in belly fat, that places an individual, it's called visceral adiposity, which is fat around the trunk, or the increase in fatty tissue around the trunk. Those fatty cells tend to place individuals at higher risk for developing diabetes. And then because there's a decrease in energy, there's a decrease in stamina, we begin to see the activity levels of these men decrease. And so whereas they used to be very active and worked out, and were very physically fit, we begin to see a decline in that. And because of that, they're more sedentary, and that in and of itself as well places them at higher risk for developing diabetes. When we're talking about weight gain, because of the decreased levels of hormones, we see an increase in obesity. So individuals who typically had a normal BMI, or BMI that was within normal range for their height and their weight, we begin to see the BMI increase, as well as the development of metabolic syndrome. There's also a cognitive decline, a decrease in cognitive functioning. These individuals aren't as sharp when it comes to their cognition and their ability to think and to do things, and they begin to forget things. And so we begin to see a bunch of different things happening. And if we're not careful, there could be, some confusion around what's going on. We also see a higher rate of depression and anxiety and panic attacks and suicide in men during this time as well. Since we're talking about men's health, we are also going to focus in on the mental health as well. And so whereas individuals who might already be dealing with some depression or anxiety, we begin to see a stark increase in their symptoms and the number of depressive days that they experience. So it is so important that that you are surrounded by a really strong support system, that you feel comfortable talking to others about what you're dealing with, and not allowing the stigma of mental health to cause you to shrink back or to cause you to isolate yourself. Because it's during these times where our men really need to be surrounded and know that they have support, and know that they can turn to someone for help without being judged or without a stigma or, things of that nature. They're gone are the days where men don't show their emotions. Men, we want you to show your emotions. We want you to be in touch with your feelings and things of that nature, so that when you are going through something, that you can say something and you can get the assistance and help that you need. It is so, so, so important that our men, well, everyone, but now we're talking about men's health, that men feel comfortable talking about their mental health, talking about what they're going through in their bodies, because changes happen and it's real. And if you think you're the only one that's going through something, you're not. There are so many men that are going through the same thing that you are. But one thing about the difference between men and women, we talk about it. Girl, I don't know what's going on. I think I'm having a hot flash or, something. We talk about it openly, whereas not so much in the male with the male and the men. So it's okay to have those conversations. Women, if we begin to see changes in our husbands, our loved ones, our brothers, our cousins, our partners, what have you, let's make sure they have a safe space to where they feel comfortable talking about the changes. Let's not be judgmental because we don't know what's going on and there's changes and we just don't understand. So let's give some grace, and as the men are going through their change of life, it's a big change for them as well. And so they're noticing changes in their body and they're not comfortable or confident in what's going on, especially when it comes to their sexual health. And so we got to be careful with how we handle those things. So what do we do for men who have a decrease in hormone levels? There's many different things that we can do. So we're going to talk a little bit about, we talked about andropause and we kind of know what that is and what it looks like. Excuse me. But some of the things that we can do in terms of managing it is, one, lifestyle modifications, as we talked about, making sure they're eating a healthy diet. I love the fact of eating the rainbow. So eating all the foods, all the colors, healthy foods, the veggies, the fruits, the healthy starches and the healthy fats are going to help. Increasing the exercise. We're not necessarily increasing exercise, but changing up the way that we're exercising, because what you were doing when you were 20 may not necessarily work for you now that you're 40, 50, and 60 years old. And so your exercise regimen may look a little different. And so you got to play around with that. If you were heavy on cardio and light on weights, maybe switch up that. Of course, with all things, make sure you're talking to your healthcare provider in the event that you have any underlying conditions that could cause additional issues if you were to begin strenuous exercise and things of that nature. So just kind of play around with the exercise and see what works for you. But the key is to maintain muscle mass, maintain bone mass, that we're getting the strength-based training in so that you are keeping your bones strong. And then sleep. A lot of individuals who are dealing with andropause begin to have insomnia where they're not able to get a full night's rest, or they're not able to fall asleep, or you fall asleep, you'll sleep for maybe a couple of hours and then you're up, as they say, counting sheep, trying to go back to sleep. So looking at ways for sleep hygiene, and we'll talk about that a little bit. So what does that look like? What is sleep hygiene? Sleep hygiene is putting into practice or putting different steps into place to help you wind down at the end of your day to prepare yourself for sleep. Much of the research that I've read is that no TVs in the room. You leave your electronics outside of the room. For many, that's not feasible. And so just making sure that you put into place different things. You're stopping TV at least 2 hours before sleep. No screen time, an hour or so before you sleep. When you're in the bed, your bed is for sleep. It's not for scrolling social media, things of that nature. Maybe you get your gym clothes out the night before and have it right at the side of your bed, at the foot of your bed, or somewhere close by. So if that's your goal to get up in the morning, you've already set yourself up for success for the next day. Turning your phone on do not disturb, putting in different settings on your phone that it shuts down, so that if you wake up in the middle of the night with insomnia, the first thing you tend to do is grab your phone. Well, you got to put in this long password in order to get into your phone. So having those things in place to where if you were to wake up at night, that you have a plan of trying to get back to sleep. And of course, there's different things. There's the chamomile teas. There's, different things that you can take to help for sleep. But again, melatonin was what I was reaching for. But again, I want you to have that conversation with your healthcare provider before. And then psychological support and counseling. It is okay to go to counseling. okay to talk with someone. And I feel just from clinical practice and working with male, female alike, that there are many of the male counterparts who shy away from going to counseling and talking with someone. And then, of course, we do have medications and medical treatment like hormone replacement therapy under professional guidance. There's so many different things that you can get on the line and on the internet and things of that nature. But you want to make, and I'm not saying those things are bad, because in the right setting and use the correct way, they can be very helpful. But you want to make sure that you're being treated correctly with the hormone replacement. So regular exercise, again, I mentioned strength training. That helps to boost the muscle levels as well as testosterone levels. And then put it in the cardio, guys. I know you guys love your strength training and lifting heavy weights, but cardio is going to help with the heart health and help to decrease the fat that you're accumulating because of the shifts and changes in the hormones. We talked about the balanced diet, lean proteins, healthy fats, whole grains, foods that naturally boost the testosterone, eggs, tuna, fortified cereals, and beans. And then sleep. 7 to 9 hours of sleep per night help to regulate hormone. Whenever we're sleep deprived, our hormone levels are all over the place. Our cortisol levels are through the roof. Cortisol levels are through the roof. Cortisol, it holds on to fat. And so our cortisol levels are elevated. We begin to see that we're gaining weight, and so many different things that come into play with that. Stress management. Working on stress relieving techniques can be important, especially as there's different changes that are occurring within the body. Meditation, yoga, some people, have different things about yoga, but do what works for you. Deep breathing exercise, and then work-life balance. When you come home from work, does work come home with you, or do you leave work at the office? Or have you been able to shut down when you come home to say, okay, I'm home and this is what I'm doing? Or if you are someone who works at a very high functioning, high level job, what are you doing to make sure that you have work-life balance, that you can separate and disconnect from work? When was the last time you took a vacation? When was the last time you did something that you enjoy? Think about that. Those are ways to help with stress management. What do you enjoy doing? Do you have a hobby or something that, helps you take your mind off of all of the, other things that you have to think about, and just give you some time to breathe? So think about those things. Medical intervention. We talked about the hormone replacement therapy, and there's many different healthcare providers who can help you with that. We're one of the individuals that can help with hormone replacement as well. So reach out to your healthcare provider. And many times your healthcare provider your primary care may not be well versed or specialized in hormone replacement. There are many different healthcare practitioners who are. I can say for me, I see a holistic functional medicine practitioner who helps me work through the different changes when it came to my hormone levels. And I know she sees a lot of men as well. Getting your regular checkups, monitoring the hormone levels and your overall health with your healthcare provider. Some of the lifestyle changes that can help with these changes is reducing alcohol consumption. What we would begin to see is, because of the stress, because of the changes, because of the not understanding what's going on, the decrease in anxiety, the decrease in depression levels, or the days that you are experiencing depression, we begin to see an increase in substance abuse, self-medicating, because all of the things that are going on in the mind and just in the body. And then smoking. There's many different things that are available that can help individuals who are dealing with substance abuse or tobacco use and abuse. And then maintaining a healthy weight through diet and exercise are some of the lifestyle modifications that can be made for men. The one thing I want to always highlight is that there's always a place and time for you to get help, to seek help. And The national suicide number is 988, I believe. I think that's the right number. But there is help out here. It's not the end all be all. And when you begin to experience these things in your body, knowing that you have help and knowing that there's something that can be done to help you is important. So as we begin to close tonight, I just want to say I applaud the men who are going to get the assistance, going to get help, and not just giving into the changes and not paying attention to what's happening to their bodies. You can turn on the TV, you can go on the internet, and you'll see a million commercials for men's hormone replacement therapies and things of that nature. Do your research, do your due diligence. If you are seeking out a provider, make sure that they are knowledgeable, make sure that they are following, the different guidelines and things of that nature. Because the last thing we want you to do is go and start taking some type of supplement, not really know what the impact of it is on your body, and then you have some health issues behind it. But there are safe treatments that are available that you can receive that can help. So listen, man, don't suffer in silence. Don't feel like you have to go through this alone, because you don't. So just as women have menopause, men have andropause, and it makes sense now, right? It makes sense when we think about the different symptoms and the different things that are happening within the body. And we think back, can this be? Most likely it is. And so as we continue Men's Health Month, next week we will continue our discussion on men's health. And I have some other topics that some individuals have sent me via direct message, and I will try to kind of pull them all together in one setting for our next Wellness Wednesday. We're going to go ahead and end tonight, but I just want to say thank you all so much for each and every one of you who are watching this live, who watch the video or the session on demand. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Stay safe and be well. Until next time, we'll see you later. Have a good evening.